Welcome back to the IPE Guidebook. Last time, we saw how a healthcare team is assembled around the patient. Now we zoom in on its center, the core clinical trio, the physician, the nurse, and the pharmacist. Start with a single patient, someone living with diabetes. One patient, but three lenses. The endocrinologist watches the glucose. The ophthalmologist watches the eyes. The nephrologist watches the kidneys. The same person, seen through different expertise, and that's the heart of how this trio works. First, the physician. There isn't just one kind: internist, surgeon, pediatrician, psychiatrist, emergency physician, physiatrist, each brings a different lens. But the physician's defining task is integrative decision-making, weaving together what the nurse observes, what the pharmacist flags, and what the therapists report, to reach a diagnosis and set the course. Crucially, never alone. Next, the nurse. Three roles stand out: direct care, vital signs, medications, wounds, and patient education. Observation, present around the clock, the nurse is the one who detects early deterioration first. And coordination, the nurse is the living link between the patient, the physician, and every therapist on the team. Then, the pharmacist. First, drug therapy, understanding effects, adverse effects, and interactions, and preventing dangerous combinations before they reach the patient. Second, patient education, how and when to take medications, and managing the full medication history. And third, a clinical role. In the ICU and emergency department, the pharmacist works right beside the physician and nurse, where the right call can be decisive for life. So how does the trio actually work together? Through electronic records, sharing information in real time. Through multidisciplinary rounds, reviewing and planning jointly. And in emergencies, through rehearsed role distribution, the physician diagnoses and sets the course, the nurse stabilizes and intervenes, the pharmacist prepares and verifies the dosages. Expertise matters, but treatment succeeds only through collaboration. Let me underline one thing: the nurse's defining strength, observation. A subtle color change at a wound. A faint shift in a patient's consciousness. These are caught first, at the bedside, by the person who is simply there, continuously, attentively, around the clock. Let's recap. 1. The physician integrates many lenses to reach a diagnosis. 2. The nurse's observation and coordination hold the whole team together. And 3. The pharmacist safeguards drug therapy and is decisive in critical care. In the next episode, we meet the rehabilitation professionals, the physical therapist, the occupational therapist, and the speech-language pathologist. To go deeper, explore the full IPE Guidebook from Telios Books. See you in the next episode.